like to respectfully invite Dr. Abhijit Chatterjee sir and Dr. Trivedi sir to kindly grace the stage to our chairperson. Thank you, sir. May I now invite Dr. Santosh Kumar, sir, Associate Professor of Medicine at IGIMS Patna. Sir will present on timing of physical activities and chrono nutrition in diabetes remission. Please welcome Dr. Santosh Kumar, sir.
Thank you. Good morning, everyone, and thanks to organizing committee for inviting me here. And my topic is slightly different from earlier speakers, and it is just first topic is timing of physical activity and chrono nutrition in type 2 diabetic remission. Due to burden of pills and economic condition of the patient, this is important topic for everyone clinician, and I think this is important topic for all of us. And we know that HbA1c, we can diagnose and diabetes on the basis of HbA1c level. If below HbA1c, that is under non-diabetic, and if HbA1c level is more than 6 point, we diagnose as diabetes. Now, is it possible to diabetic remission? This is a interesting topic, and I think diabetic remission, we can classify diabetic remission into 3 types: partial remission on the basis of HbA1c and duration of glucose level between 100 to 110, and in the absence of any drugs and pharmacological therapy. And second one is complete remission. It is called when HbA1c is below than 6 and fasting blood sugar is less than 100, and we called prolonged remission when it all lasts for 5 years without any pharmacological therapy. Now, why we are talking about diabetic remission? Because diabetes is not a single entity disease. It depends on polygenic inheritance. Second one is obesity is important factor because it causes insulin resistance. Third one is hepatic steatosis due to obesity, increase in lipid level in liver, which causes decrease the insulin sensitivity, and these two endocrine disturbances lead to increase in the hepatic glucose production as well as lipid metabolism and peripheral glucose metabolism abnormalities. Now, basically, this is a twin cycle hypothesis in which one is liver cycle is involved, and second one is pancreatic cycle. Due to any positive calorie balance causes hepatic steatosis, and which causes decreased insulin sensitivity, which lead to increased basal insulin secretion. And second cycle is involved pancreatic cycle. Due to increase in the LDL lipid abnormality in the blood levels, which causes decreased insulin response to integrated glucose, and it lead to postprandial hyperglycemia, which causes basal sugar level, increase in basal sugar level. Already diabetic remission come in last 10 years. Its main topic comes due to when bariatric surgery come in our in India or other country, because decrease in the weight, which causes decrease in the sugar level. And one study also shows the remission of type 2 diabetes always more question but enough answer for action. Is it possible? One study in US shows diabetes 2 less than 2 years of diagnosis, higher rate of remission in if weight loss occurs in patient. One study from England also show it show only 1.7% of the people met the criteria of diabetic remission. And if BMI reduction more than 10%, which causes 3.57 odds ratio compared to less than 5% reduction in weight. Now, what are the predictor of diabetic remission? First one is age. Second one is BMI. Agar more than BMI, that lead to less chances of remission. Third is duration of diabetes. Earlier diagnosis of diabetes can lead to diabetic remission. Fourth, baseline C-peptide level. Another factor is fasting blood glucose level, low HbA1c level at the time of diagnosis, and waist circumference is more important, and blood triglyceride level, which included in liver cycle and pancreatic cycles. Now we already know that there are 4 options in our at the time of diabetic remission. First one is lifestyle dietary modification. Second one is chrononutritive exercise. Third option is medical therapy. We have already known about lots of about medical therapy, and last one is bariatric surgery for weight management and diabetes. My topic is concerned with only dietary intervention and exercise in diabetic remission. One larger trial shows that can lead to remission of type 2 diabetes in a significant proportion of participants, when with about 46% achieving remission at 12 months. Now, what is circadian rhythms? We know that 24 hours regulated by endogenous molecular oscillatory mechanism in our body, that is called circadian clock. It can be controlled by law of many of genes like PERL1, CRIL1, clock, BML, and it is controlled by suprachiasmatic nucleus, that is master clock of our body, and control every enzymatic on every organs. And it is controlled by, that is affected by our day-night shift changes, day-night variation, and most of the peripheral organs have an independent autonomous control of the circadian rhythm, but our main tissue organs just like liver, pancreas, and adipose tissue are dependent on the circadian rhythms. This picture shows already the circadian rhythm is controlled by suprachiasmatic nucleus, and it controls the various organs of our body. Mainly role is increase the GLUT4 expression in our body, which have role in the sugar metabolism. Now, what is the glucose control metabolism in our body? We already know that glucose is lower by insulin, amylin, and somatostatin, and second, increase in glucose level by glucagon, cortisol, growth hormone, thyroid hormone, and epinephrine. These are already hormones, and insulin is also independent on the circadian rhythm, our food activities, stress, cortisol, thyroid hormone. And lots of studies found that sensitivity of insulin in our body is more in the morning compared to evening, and its clearance is high in the night. And also beta cell response is higher in the morning. Second, controlling of the glucose is our glucagon. Glucagon, which have already showed that lower activity during the day and higher at night or fasting during cortisol. Third hormone which control our glucose level is cortisol, which level is peak in the morning and gradually declining throughout the day and reaching its lowest level at the evening. Fourth hormone also affect our sugar level is growth hormone. Its peaks occurs during sleep and lower level during waking. Thyroid hormones peaks at nights and late decrease in the late afternoon. Another hormone is somatostatin, which decreases the glucose level, which peak level occurs at midnight and lowest in the morning. And last one is epinephrine, which increases the glucose. Its level is peak in the morning and low in the night. These are all relevant in our glucose metabolism. That's why I am called it. Now, what is the time of exercise and what is important? Because several studies suggest the diurnal oscillations suggest glucose metabolism is better at a specific time during the day, and incorporating exercise during that time may result in better glycemic control. Second one, physical activity in the afternoon or evening may be more beneficial for circulating glucose and insulin sensitivity. Now we are already following that morning activity is better for weight management and adherence to the weight. Postprandial activity या postprandial exercise provides better postprandial glucose control and longer duration of sugar control. Now one term is exercise snacking, and it means 6 times 1 minute brisk walking 30 minutes before a meal reduced 3 hour postprandial glucose after breakfast and dinner compared to traditional 30-minute moderate intensity exercise. And postprandial exercise is also important because it lowers postprandial hyperglycemia and triglyceride level. This is the picture how it shows how our day-night variation can change the hormone and sugar metabolism in our body. Now, what are the benefits of exercise? We have already known about a lot of facts about that exercise affect almost all organ of our body in brain, either liver, either pancreas, muscles, and blood vessels. Now, what are the type of exercise we can choose? First one is aerobic exercise, which is repeated and continuous movement of large muscle of our body and includes walking, jogging, cycling, swimming. Second one is resistance exercise with free weights. It includes weight machine, body weight or elastic resistance bands. And third one is flexibility exercise, range of motion around big joints, and balance exercise to reduce benefit gains and prevent falls. Every exercise is its own benefits. Now, what is the benefit of aerobic activity? It increases the mitochondrial density, insulin sensitivity, oxidative enzymes, compliance and reactivity of blood vessels. Moderate to high volume of aerobic exercise increases the cardiovascular and overall mortality risk. And regular training leads to reduced HbA1c, triglyceride, blood pressure and insulin resistance. High intensity interval training increases the skeletal muscle oxidative capacity, insulin sensitivity in the muscles, and glycemic control, overall glycemic control. Now, second one is resistance training, which increases body muscle mass, body composition, strength, physical function, mental. When resistance and aerobic exercise both included in our activity, it leads to less hypoglycemia than when aerobic exercise is performed. And stretching is also important for increases the range of motion around joints and flexibility. And balance training for particular patient which reduces fall in risk. What is the effect of time exercise? Lots of studies have published, and it increases either pre-prandial or post-prandial exercises. Both are effective in glucose monitoring and triglyceride levels. What to do? Next question is what to do for all of. Consistent exercise is important regardless of when it occurs in intensity, and try to develop an exercise routine to which we can adhere. Any time is the most important according to our job, service, ability of the time. And pre-meal exercise may help insulin sensitivity, while post-meal exercise may reduction in postprandial glucose. This is the picture which showing type of exercise and their roles and their frequency. Now what is chrononutrition? Second topic is our chrononutrition. It deals with fields of.
Dr. Saab, would you please wind up your lecture? We are running short of time.
Okay, sir, sure, sir. Now, what is chrononutrition? Chrononutrition is timing of nutrition with adding our nutrition with time, and it consists of three behavior: timing, frequency, and regularity. Within chrononutrition, the term known as chronotype refer to everyone's natural inclination to experience period of high energy or rest depending on the time of day. And on the basis of the chronotype, there are three types: morning type, night types, and neutral or undefined types. This is a picture how our chrononutrition is associated. We are affected by age, sleep, shift work, social jetting, light work cycle, and genetics. And what is chrono disruption? Alteration in the function of the circadian rhythms, especially a disturbance in critical timing of internal biological process in response to external causes, and it leads to adverse health outcome. And common chrono disruptor include the use of artificial light, screens, mobile screens, sleep deprivation, and night-time meal consumption. It leads to higher risk of developing metabolic pathologies such as obesity, alteration in glucose metabolism, diabetes, dyslipidemia, and other components of the metabolic. Now, what is the next? Within 2 to 3 slides, I would conclude. First is meal timing. Person who skipped breakfast had a 21% higher risk of developing hyperglycemia than who consumed breakfast. Omission of breakfast lead to significantly higher energy intake, fasting total and LDL cholesterol, and significantly lower postprandial insulin sensitivity. Late evening meals after 8 p.m. may cause postprandial hyperglycemia with decrease in glucose tolerance for morning toward the nights. And some study also suggest divide dinner into two smaller meals in which post-meal glycemic effusion is reduced by second meal effect phenomenon. And what is the meal composition? High calorie meal in the morning versus evening, it shows greater reduction in fasting blood glucose levels, and carbohydrate it depends on quantity, quality, type, rate of digestion of dietary carbohydrate. Early versus late night carbohydrate consumption, which causes postprandial hyperglycemia, and low GI glycemic food index should be preferred. Consumption of more carbohydrate and fats in the morning breakfast while less amount of saturated fat and sugar in a dinner show good glycemic response, and high protein meals in the night can reduce postprandial hyperglycemia at night. Ingestion of fat half an hour before a potato meal or carbohydrate meal attenuate postprandial glucose and insulin. Milk protein given as a preload prior to consuming bread rather than coexisting both food lower postprandial glycemia and insulinemia. And consumption of vegetable followed by fat and protein, then lastly carbohydrate is the best sequence to attenuate glycemic response. And what are the food components? These are already studied: green tea, coffee, which causes reduced risk of type 2 diabetes mellitus. And these are studies showing the effect of exercise and chrono nutrition in our diabetic control. And what is the take-away message is an educated diet structure is fundamental. Having a greater proportion of the energy requirement during the morning, reduce carbohydrate intake during the afternoon is recommended. At least 3 main meal times, avoiding skipping breakfast, and having a night-time fasting window of at least 12 hours. Implement an appropriate macronutrient intake order. First, start with fiber-rich food like vegetable, then protein, and lastly carbohydrate meal. Combine the 3 macronutrients in each meal. Avoid the ingestion of over-ripened fruits, and lowering the pH of the food using vinegar or lemon juice to delay gastric emptying causes sugar control, better glucose. And nighttime eating and frequent snacking during the snacks should be avoided. Sleep hygiene and ensuring an adequate number of hours of sleep per night is essential for sugar control. And these some of the studies are published in recent newspaper. Why early dinners are back on the table for health. Thank you. Thank you for your patience, sir.
Thank you.
Just this is a counseling part, and I think every clinician should be focused on this part. At least education awareness about before treatment, lifestyle modification is always the first priority of ours. So then we can guide, and we so important the postprandial hyperglycemia that is largely uncontrolled in all number of patients.
And what about the exercise immediately before a meal? Can it lead to hypoglycemia? While I understand that it improves the glucose sensitivity.
Yes, sir.
But then it can also lead to
That is not a aggressive exercise. Only 1 to 2 minutes walks, brisk walk. That's not brisk exercise.
any questions from any members of the audience? If there are no questions, I ask the members of the audience to give him a big hand. Thank you.
Thank you, sir.